Oh, I voted to repeal the health care law. If you look at the goals of health care reform, those are to provide quality, access, and low cost. It did nothing about cost, and it will explode the deficit going forward. I still practice medicine. In my 20 years of working in a public hospital, I've learned if you don't control cost, eventually access hurts and quality suffers. And so you end up under that bill with none of the three because it didn't address cost first. You're going to think I'm making what I'm about to say up, but I told you I still see patients. When I do a liver biopsy, right now it takes me maybe 3 minutes to do the biopsy at the bedside. It takes me about 10 to 15 to do the paperwork. Now, you think I'm making that up, but no, that's how long it takes. And so we've just created this bill, not me, but this bill, over 150 boards, bureaucracies, and commissions. Now, is that paperwork burden going to get smaller, or is it going to get larger? Is the amount of time I spend not seeing patients, not talking to somebody, but rather filling out forms, what's going to grow? It's interesting. I speak of a government-centered program like we just passed, or a patient-centered. Patients commonly want to have more time to talk to their physician. But time is a zero-sum game. This bill is just the mandates inevitably are going to suck away that time a physician has with his patient into fulfilling paperwork and reporting requirements. Patients will notice that they have even less time with their doc. That's a bad thing. We have to still continue to talk about the bad things that are going to happen. As long as the administration is able to, oh, it's going to be wonderful, just give it time, then the more it kind of ingrains itself, embeds itself into the economy, the harder it's going to be able to pull it out. So one, we have to continue to talk about the $500 billion in new taxes. We have to talk about the fact that it takes $500 billion from Medicare, not to shore up the safety net, but to create another entitlement which is poorly funded. Or that for Medicaid, it doesn't strengthen it, rather it just adds 16 million more people to it, further straining state finances. We have to continue to talk about that, and where there's opportunities to defund portions of it, or repeal a small piece, we do that. My hope is, between the American people objecting and Congress's ability to defund and remove, we end up with maybe not the whole thing repealed, but a portion here, there, and there. It ends up looking like Swiss cheese, with the structural integrity of Swiss cheese. And at that point, we can come back and replace that whole piece with something that works. Oh my gosh, that is so true. The week this bill passed, the New York Times had an article about a woman in Michigan, had ovarian cancer, and Michigan Medicaid paid so poorly that her provider was going bankrupt. Her provider, her oncologist, had so many Medicaid patients, she was going bankrupt. And so this woman with ovarian cancer had to be released from the oncologist's practice because the oncologist could not make her bills. Now, this is the bill we're expanding. This is the program we're spreading out over everyone else. And there is a human toll to this. We actually looked up this woman, what happened to her, and a week after the article was published, she died. There is a human toll of this facade of coverage, this illusion of coverage, but no power of coverage. And that human dimension is costly in health, and it's costly in life. Well, clearly they had to fund it. And so they put $500 billion in new taxes. You may recall that candidate Obama said that he was going to extend coverage to everybody and actually lower the typical family's annual health insurance premium by $2,500 a year. As it turns out, that premium is higher. He said as a candidate there would be no individual mandate. There is an individual mandate. There is a lot of intervention that they've had to do and a lot of taxes they've had to levy in order to theoretically make this thing work. But it's not the command and control economy didn't work in the Soviet Union. command and control economy does not work in healthcare. This bill is ultimately a command and control. I don't know that. That I think is clearly interesting. But the fact that how many states were party to that? 26 states or something? 26 states, a majority of states, brought action against the federal government, rejecting a policy that the federal government is attempting to foist upon the American people in of itself is a message. The fact that the court found with them in of itself is a message. November the 3rd, the American people rejected Democratic candidates because of health care. It's almost like the people, the courts, and the states are arrayed in opposition, and the administration says, we don't care. I'm not sure how that is going to play out, but the message it sends independently of how it plays out in the Supreme Court is profound.